Man, this is getting tiring, folks. It is Monday, December 13th, and Omicron news is taking over. We even now have news of the potential first death of Omicron. Now, I'm going to talk about this and some of the wording that was used for this first death. We're also going to talk about some other updates that could affect markets and, of course, well, our society. So, folks, let's just get right into the news. Let's pop on over to our usual handy-dandy flowchart. So first things first, let's talk about this first death. According to Boris Johnson, with confirmation this morning, one person has died with Omicron in Britain. He says, quote, and sadly, at least one patient has been confirmed to have died with Omicron. Now, I am adding the emphasis. Why am I adding the emphasis? Because, folks, we know that when we look at South Africa, many individuals who are hospitalized and then are discovered to have Omicron are hospitalized for a reason that is not Omicron. They just happen to have Omicron while they're in the hospital. And so my question is, and we don't have the details of this yet, but I think it's critical because I expect that markets are negatively reacting to, as usual, the headline that a person with Omicron has died. But wait a minute, why did Boris Johnson say that a person died with Omicron rather than from Omicron? Why don't we have more details yet? I think this is very important. I don't actually find this to be a conclusive Omicron death yet. Though, what do I know? I'm just being skeptical, Kevin. Let's pay attention to this. Boris Johnson did use this as an opportunity, this death, and this is expected for a politician, to basically pitch vaccines and boosters. Now, I don't blame that. I'm a big supporter of choice. You all know that. However, I am vaccinated. I encourage people to get vaccinated. I encourage the boosters. Now, I'm just being transparent about that. That does not mean I force it upon individuals. Now, Boris Johnson here says the idea that this is somehow a mild version of the virus is something that I think we set on the side and just recognize the sheer pace at which this relates or rather spreads through the population. Properly written here. So anyway, Boris Johnson is using this as an opportunity to say, hey, you know what, look, somebody just died with Omicron. We can't call Omicron mild. I think this is political speech here. I don't think we've seen any evidence that Omicron is not mild. We continue to see reiterating evidence that Omicron is in fact quite mild. That is literally what the CDC director in the United States says. Now, believe the CDC or not, it is also what we see doctors say in South Africa. It's also what Harvard health professionals say when they suggest that we could be bringing the end of COVID into our society with Omicron, as Omicron outpaces Delta, takes over Delta, and now we have the more mild form, which is great. Perfect path for a virus to take. It goes from killing its host to no longer killing its host, so it can try to survive longer. I mean, that's just a natural mutation. It's not like it does that consciously, right? But anyway, some other things to note, and some of these quite important, so very important to pay attention to these. First, United States infections have passed 120,000 per day. And this is the highest level since the Delta surge we've had in September. We do expect that cases will continue to rise, but according to Bloomberg, most of these cases continue to be described again as mild. While we expect cases to rise, remember though, most folks and the market are going to think that, okay, cases are going to go up, then hospitalizations, and then deaths are going to go up. And this whole first death thing is going to reiterate that belief. But if indeed Omicron does prove to be more mild, we might see cases go up and hospitalizations and deaths not actually move. Now, this is a little bit complicated by the fact that Delta is still the predominant variant in the United States. So the more Delta cases you have, the more hospitalizations and more deaths you're going to have. So you're going to have this weird transition period that's going to leave the market very uncertain and very confused. And when you get titles like of individuals expecting a tidal wave of infections in the United Kingdom, well, then you're going to have some more potential drama as well. Okay, now, Omicron is now in more than 30 states, including in my county, which is the county of Ventura, California. Expectations are that Omicron can fuel 75,000 deaths this winter in England. Again, these headlines, not great news, right? This is potentially another reason why our markets are pained right now. The 2-shot dose of Pfizer is estimated to be just 22.5% efficacious against Omicron. This is really bad. 22.5% efficacious against Omicron, very, very bad. Now, they do say it could limit severe disease. This is according to experiments in the South African lab studies that have been released over the weekend here. I read about this not only in the New York Times, but also in Time.com and on Bloomberg and in other sources. So this is pretty well sourced. 22.5% for 2-dose, not great. This is another reason we're seeing a lot of push for boosters, because boosters are expected to be 70 to 75% efficacious. And again, that's because of that massive drawdown in antibodies and the mutations to that tip of the COVID spike protein. Keep in mind, the reason you can still limit severe disease is because you still have a somewhat resilient T-cell response, which is good. T-cell responses are created by vaccines, but also by prior disease, which is worth noting. However, take a look at this. There is a severe reinfection risk with Omicron that if you've previously had COVID, you are 3 to potentially as much as 8 times as likely to get COVID again with Omicron compared to some of the other variants. Because we've previously thought that, hey, if you've had COVID, it's harder for you to get COVID again because you actually have more of a lasting antibody and T-cell response if you've actually gotten the disease versus the vaccine. Like, getting the disease was one of the best ways to prevent getting it again, but that changes with Omicron, which is bad. Okay, next set of news. Mild cases. Okay, here's another report that came out. It is a morbidity and mortality weekly report that's released by the CDC. They are suggesting that so far, 4 out of 5 individuals who are getting Omicron are vaccinated. So obviously, this is leading a lot of, especially the anti-vax groups, to say, why am I bothering getting the vaccine? Obviously, the goal is to avoid severe disease. We don't want people dying. But then, of course, now the question is, are people dying? Well, Boris Johnson didn't really give us clear information on this, so TBD. But anyway, symptoms right now, according to the CDC: cough, tiredness, headache, congestion, runny nose. Okay, this is mixed reports. Some people say yes, runny nose, some people say not. However, very few instances of requiring ventilators, oxygen, and as of the time of this morbidity report, no reported death by Omicron yet. Now, we know that's potentially now different because of what Boris Johnson said this morning, but we'll see. Children, we do also see more hospital admissions, because of Omicron. However, short stays, and so far no reports of respiratory complications. And this particular case with children here, not from the CDC, but rather from South Africa's health minister. Okay, then myocarditis. It's worth making a note here because this is something that's been circulating on social media here, and I just want to provide some statistics from the Wall Street Journal. Now, one of the big things is right now scientists are not sure why it seems like there's an increase in myocarditis or pericarditis in some small number of cases in individuals, particularly in boys. A vaccine is worth noting. The vaccines, per a United Kingdom study, have a 99.995% chance of survival over 1 year. So getting the vaccine, really, really, really low chance that you're going to die from it, at least per research. Now, myocarditis was diagnosed in 2.3% of 1,597 college athletes who had COVID. So this is interesting that 2.3% of individuals who had COVID, and especially college athletes, they got myocarditis, which is inflammation of the heart. Now, there's limited data on myocarditis in those who aren't vaccinated versus vaccinated, so there's still a lot of research to do. But so far, we do know that out of 1 million boys aged 12 to 17, you'll end up seeing somewhere around 67 cases of myocarditis. That works out to about 1 in about 15,000 people are going to get myocarditis. Now, there's some theories for this I'm going to talk about in just a moment. For girls, it's a lot less. It's about 1 in 111,000, so much more rare. None of these cases ended in death, and most of them were mild and resolved quickly. So again, according to the Wall Street Journal. And the theory, there are a couple theories for this, but one of the theories is that the mRNA vaccines create a protein that your body could have an inflammatory response to, and that potentially people are getting that in their heart, especially if there's an improper injection of a vaccine directly into somebody's vein, sending basically the vaccine, the drug, to the heart muscle through your circulatory system. Theories. These are just theories. But the highest risk of myocarditis is really within 7 days of getting your second dose of Pfizer or mRNA. and most get better without medical treatment. And these are the sources for that. So if you want to pause and look those up, you can look at those. Now, China did also detect its first case of Omicron in a port city. This is a potential risk factor, obviously, for markets and supply chain constraints. The last thing we want to hear is more port shutdowns. In South Africa's National Institute for Communicable Diseases mentions that cases are skyrocketing, still higher over the summer, but we went from literally 0 cases to over 50,000 cases in less than 3 weeks in South Africa. So in a very short period of time, we are rivaling case counts of what we've had earlier in the summer, especially with our Delta waves. Hospitalizations have inflected down, though. This is actually a very good sign. If you look at hospitalizations in South Africa, they've started to inflect down after initially going up. And that could be because people were fearful that they had COVID, they're checking themselves into the hospital, and now people are not as worried because we're finding the symptoms were mild. And so you're getting less hospital admissions. So it's very good, to some degree, to see cases go up, but hospitalizations go down, because again, it reiterates the mild nature of Omicron. Again, reiterating here, Omicron largely evades antibody resistance. If you get the booster, you should have or expect to have around 70 to 75% efficacy, which is still not the 90% that we were used to originally, right? But then again, that 90, and this folks is only in the early days of the booster. So even if you get the booster and you're up to 70 to 75%, after 6 months, you could be right back down to 20, 30, 40%. We obviously just don't know yet. With the boosters, too early to tell. We do already know that the spread rate of Omicron is 4.2 times that of Delta, not of Alpha, of Delta. That's huge. It's this thing spreads like crazy. UK is already instituting more limits, changes coming to vaccine passports. New York City is requiring masks indoors unless full vaccination is required to enter. It is worth, I made this little note here. It's worth noting, in the early days of COVID, there were a lot of folks, they would wear masks, and then they'd say, oh, I got COVID, but it was a nothing burger. I was asymptomatic or whatever. Masks could actually increase your odds of being asymptomatic, because one of the ways you are deemed asymptomatic is getting a lower exposure to the virus. When you get a lower exposure to the virus, your body potentially might not be symptomatic, but you actually might be carrying the virus, and you might actually be fighting it. And masks can help lower your exposure. Though I do want to just, quick PSA mention that if you're just wearing the generic cloth masks that you kind of get off Etsy, so you have like one of these right here, this little rogue, World of Warcraft rogue mask order. These things kind of suck. Especially when people wear them like this all the time, it's worthless. Like, you may as well virtually not even wear these. These are deemed like 15% effective. You really should be looking at surgical masks if you're going to wear them. Surgical masks, surprisingly, kind of easier to breathe into. Those are somewhere around 50 to 60% effective. And then, of course, an N95, if you were really concerned. A valveless N95 could put you in the neighborhood of 80 to 90% effective, depending on how you wear it. Typically, you'd have to shave to have that maximum efficacy. On other news, we have the Minnesota healthcare systems. A group of doctors ran an advertisement, a page-wide advertisement, saying that they're heartbroken and overwhelmed, describing the virus situation as critical because of daily death tolls. This is mostly expected to still be because of Delta. Worth noting. We also have about 3% of our military that are still not vaccinated. This is about 40% of active duty military, and this is just days away from Joe Biden's cutoff for them to get vaccinated. Ghana's main airport will start fining airlines $3,500 for every passenger who is not vaccinated or test positive on arrival into Ghana. That was interesting, putting a lot of onus on essentially the airlines. France, 81% of the population is up to one shot. Vaccine protests in Italy and Germany saw 8,000 protesters. And in Vienna, we saw 44,000. Germany is now fearful that protests that ended in violent altercations with the police could end up leading to more violence over vaccine passports and other aspects. Regarding Merck, we got an update regarding Merck here that the University of North Carolina did a study on the Merck pill. This is if you had if you were at risk of having a severe case of COVID, you could potentially get this Merck pill under emergency use authorization. However, now there's an expectation that potentially there could be birth defects or cancer induced in a developing fetus because of how this drug interferes with RNA replication, which is obviously designed to destroy the virus, but could potentially also affect children. Now, Merck responded and said the hamsters that were tested were exposed much longer than humans would have been, which to some degree kind of reiterates there is a problem, but the exposure time, that makes sense. Sometimes when you get lab rats or hamsters or whatever, you get overexposed. But the theory is, hey, if you overexpose and nothing happens, then you're more likely to be safe. If you overexpose and something happens, okay, well, now you've got to turn back the dial and you go, at what point does this start creating an issue? More on that from the New York Times. And so really, what's next? We still have talk. The chief executive of South Africa's largest private healthcare group, look what he wrote over here. He said, this may signal the end of COVID-19 with it attenuating itself to such an extent that it's highly contagious but doesn't cause severe disease. In the early days, it's the early days, but I'm less panicked. It feels different to me on the ground. This is good. This is very good. So this is a complete Omicron update here with some more information on all of the drama that's going on and a response to this first death. So let's stay tuned for more information from this, from Great Britain and of course elsewhere. If you appreciated this update, consider sharing the video. Folks, we'll see you in the next one. Thanks so much. Goodbye.